Kentucky lawmakers got their first chance to ask questions over a report alleging millions in Medicaid waste. Last month, Auditor Allison Ball released an audit claiming Kentucky mismanaged Medicaid payments between 2019 and 2022 that resulted in over $800 million in waste, many of those duplicate payments that were also being paid out by another state. Ball says it's hard to know right now how much of that $800 million Kentucky is liable for. That depends on how many of these recipients actually were living here.
It's unclear exactly where these people were residents of, whether they were Kentucky or somewhere else. We just know that there were two states paying for, at least two states, sometimes more, paying for these individuals.
Cabinet for Health and Family Services Secretary Dr. Stephen Stack has argued the report contains many inaccuracies. This week, lawmakers asked questions like if we're able to recoup any of that money and if there is shared blame as well with managed care organizations. So, Representative Moser, I want to start with you. You were part of multiple presentations this week over this report. What were some of your chief takeaways from this?
Well, to begin, we have been, since the Republicans took over the majority, we've been extremely intentional about our budget and about all that we are spending, whether it's pensions, reducing income taxes, and just making sure that we have a healthy budget reserve. And what happened when Auditor Ball finished her audit really is troubling. It's disappointing to learn that the oversight just is not in place. And I think that's really the bottom line. We talked a lot about data collection and notifications and whether or not the individuals who are supposed to be looking at this are adequately trained. And so there were several recommendations that came from Auditor Ball, and I think that that's really going to be something that we take up in Medicaid Oversight Advisory Board, which was the second presentation. But this is something that we're looking at, especially, now that this is on our radar. It should have been noticed much earlier. It wasn't. And now we have to really dig down on this and prevent it from happening again. One of the big questions was, how much money was Kentucky actually paying in this? And I don't necessarily want to say that it was fraud. We don't know that for sure. Sometimes individuals move to another state and they don't know to inform the previous state, but there needs to be a notification system that helps states really know what they're paying for.
And is that something that would be on CHFS, or would that be on managed care organizations? I want to be sure to bring in Representative Donworth on this as well. What are your takeaways here?
Well, I think, yes, there needs to be probably a federal system, because that's where it's going to see when people transfer from state to move from state to state, and can be able to accurately reflect that. I'd love to see some federal legislation that require the managed care companies to refund payments that are duplicative. But I think it's important to note here, the Auditor Ball's report, I believe, studied 2019 to 2012, or 2022, yeah. Sorry, I get my numbers wrong. And the cabinet was already aware of this because of a federal investigation, investigator general. And so I think what more importantly will be to look to see what happens in the next 2 years, to see, as we have more and more of that data coming in, to see whether they were able to turn this around. So I think that it is something we need to be watching. It's also one of those things where this is where those bureaucrats come in. Those bureaucrats are the ones that are entering the data and making sure that we can catch things like this, so that we don't end up overpaying as taxpayers.
Are there unanswered questions that either of y'all still have over this report that maybe you'll be investigating further in the 26th session?
Well, I was curious about whether or not we could recoup this money. And so that is something that I asked the Solicitor General, or the General Counsel, rather, with Auditor Ball's team. And he had some ideas, so we will explore those. It would certainly be nice to recoup if it's, I think the ballpark was $130 million, but they're really not sure. And so, yeah, it would be wonderful to recoup some of that. And then just to quickly educate folks on what this was. It was about capitated payments that are paid to MCOs. And so part of the problem is now the MCOs are getting this money from 2 states. There does not seem to be an incentive for MCOs to really work with us on this. And I'm not saying that they won't, but I think it's really the job of the Department of Medicaid.
And there's a lot to unpack there, and it's a very complicated issue, too.
Yes.
We are unfortunately out of time for this, and we still have much more ahead this morning. Coming up.